There are 11-year-olds, they're asking for drunk elephant and doing all these full nighttime skincare routines.
On the Health Watch, skincare routines promoted to a lot of teens on TikTok can be harmful as well as expensive.
So I have so many mixed feelings about this entire topic, but it does get frustrating sometimes dealing with the misinformation that's out there.
And what these girls are doing is it's not just about caring for their skin, it's really about curating their identity for social media.
Is there this pressure that's stronger than ever for them to look or be perfect?
What do beef tallow, LED masks, and 10-year-olds with 10-step nighttime skincare routines all have in common? They've all gone viral on skincare TikTok, but are they actually safe? Hi, everyone, and welcome to In Focus, the podcast that brings clarity to your family's eye health and your life. I'm your host, Dr. Rupa Wong, a board-certified pediatric ophthalmologist and mom of 3. And today's episode is a must-listen for any parent with a skincare-curious tween or teen, or anyone who's just bought a product because an influencer told them to. Joining me is the incredible Dr. Kristina Collins, Harvard-trained, board-certified dermatologist and Mohs surgeon, co-founder of Austin Skin, and the creator of Foy Skincare. You've probably seen her busting myths on TikTok, educating her followers on sunscreen, and warning against some of the more out there viral skincare trends. Today, we're talking about the good, the fad, and the ugly side of skincare, social media moment, especially for kids. Thank you, Kristina, for joining us today.
Thank you so much. It's great to see you.
This is going to be such a good episode, and I think we could probably talk for hours about it.
About anything.
We could talk for hours about anything. I know that. But even just about the subject of everything that is on social media. So first, let's just talk about Tween skincare. You already know, I have an 11-year-old. She literally has a skincare fridge that she requested from my parents for Christmas. She has a more elaborate skincare routine than I do. And I've had to go in there and edit it because to tell her, you don't need this, you don't need that. You know, there's a lot that they are seeing. She doesn't even have a phone, so I can't even imagine what she'd be exposed to if she had a phone. I mean, there are 11-year-olds, they're asking for drunk elephant and doing all these full nighttime skincare routines. So what's actually necessary for kids? And do they even need a skincare routine?
So I have so many mixed feelings about this entire topic. I think at times I feel like the Lone Ranger that's actually like, you know what, this could be positive for kids in some ways. And I think there's multiple ways I think about it. On the positive side, we know, as I have kids that are 3 and 7, so I'm on the early stage of things, we all have these moments as moms where our kids have gotten into our makeup, put it all over their face. You know, we take a big picture of it. We send their mascara covered faces to all of our friends, like, oh my gosh. It's so natural for our kids, especially our girls, to watch us getting fancy for events and want to partake in that. And I think culturally, people all through time have shared in skincare and beauty rituals. So it's really just this innate thing that we want to have these day spa days with each other and makeovers with each other. And I think we're also seeing this byproduct of kids that were really raised by moms that are in our age groups that focused on skin health in a way that people never did before. So we put sunscreen on our kids on a regular basis. We were talking about healthy skin. We were taking care of their skin. And it's very natural for those same kids to now be interested in skincare. But then, of course, on the negative side, as you alluded to, we wonder, as moms, our eyebrows go up and go, where is this interest truly coming from? Is it that, or is it more we are seeing that they're constantly inundated by these filtered images that they're trying to emulate? And is there this pressure that's stronger than ever for them to look or be perfect, which can be negative for their self-esteem? We know that kids nationwide are having self-esteem issues. So we have this kind of two-sided look at things. To answer your question about whether I think teens and tweens should have skincare, I actually do. So we encourage our kids to brush our teeth every day. For my 3-year-old, it's like almost impossible, but I am just really impressed by the parents that manage to make that happen on a daily basis. But we expect all of these sorts of healthy things. We send our kids with water bottles everywhere. dating myself, but in perhaps our day,
Yes.
we drank out of a hose in the backyard and we
Yes.
drank out of water fountains. Now our children, literally, you are blacklisted as a mom if you don't have your child with a bottled water
sure.
of some kind.
For sure.
So we are teaching them about health. And I think it's natural to teach them about skin health. Skin is our largest organ. Mm-hmm. It is important for our entire bodies to have self-care in this area. So teaching them that basic skincare routine of washing their face and putting on moisturizer twice a day, and in the morning using sunscreen is absolutely an important part of health.
I love that. And I know that you and I have also talked about just skincare in general being self-care, which I think is such a great way to look at it
Yes.
as well for us as adults, but it's not necessarily a bad thing to introduce to teens and tweens.
Absolutely. I mean, if we talk to our tweens and teens, we might find that doing these little rituals at home makes them feel relaxed. Just like as moms, we take a bath and we do our mask. Maybe that makes us feel relaxed. So they may be enjoying some of those same features of self-care that we are. It's not always about that pressure to look a certain way. Sometimes it's about something that they enjoy doing that actually makes them feel like they're taking care of themselves. And I think kids are always looking for that way to kind of be more mature. Yes. That little glimpse into adult world, how they try on our shoes, how they try on our makeup. And skincare can be an extension of that and can actually be a way for us to kind of bond with them in that way. So in a way, it can be really positive, I think. And when it's not coming from a place of that lack of self-esteem, it can be a way for us to bring a conversation about health into the picture for a lot of kids using something that they're already interested in.
I love that. And I think that's so important to highlight. But then getting back to the potential negative aspect of it, are there ingredients that we as parents should be watching out for to make sure, as prescriptive strength additives or exfoliators? What should tweens or teens not be putting on their face?
Absolutely. I think the concern is, teens, preteens, kids, their skin tends to be thinner than ours, really more sensitive than ours is, more at risk for inflammation and different types of disturbances. So some of the products and ingredients that we as adults really utilize for part of an anti-aging regimen, we're looking to increase cell turnover. We're looking to try to erase some things. Those things are not supposed to be part of a teen regimen or a kid regimen. It can actually cause their skin to get really irritated. So we're seeing a lot of kids with skin barrier that's breaking down, that's impaired, seeing kids that have things like perioral dermatitis, which is a form of rosacea, which has to do with irritation from ingredients in that case. We see kids with eczema and rashes and even kind of reactive acne due to the number of products and the strength of the ingredients being used. So on one hand, you've got ingredients like hyaluronic acid, which is a great hydrator. It's super gentle. Kids and adults alike could use this ingredient to moisturize their skin. Things like niacinamide, which is a nice antioxidant that helps protect your skin from sun damage. So when the person uses a moisturizer with niacinamide or something similar, perhaps their skin is a little more protected against some of the effects of UV radiation, but it's not irritating. And then on the other hand, you have some of the stronger exfoliating products like glycolic acid, alpha hydroxy acids in general, really strong retinoids, and even vitamin C, ingredient that we use a lot as an adult, could be okay for kids, but in some kids, it's just too much for their skin. It's going to cause this background of inflammation, which can lead to all these other types of rashes. But again, like on the flip side, there's always a counter side to everything, which is, I think we all know as doctors, hormones are basically changing at a faster rate than ever. Kids are going into puberty earlier every year. So a lot of kids, even age 9, 8, they're in that pre-pubertal phase where their skin is creating more sebum, their microbiome is changing, and their skin is really setting up to have acne. Acne is extremely common for kids and is a massive cause of anxiety and depression for kids. So even some of these products like retinols can be helpful for teens in the right setting, or even young kids in the right setting, if they are showing signs of having increased sebum production, which is leading to maybe clogged pores or comedones. And we're seeing that they are having the beginnings of starting acne. We can kind of nip it in the bud with some of these ingredients.
Oh, that's interesting. I didn't even think about it from that perspective, that because puberty onset is a little bit earlier, they might actually require some of these types of skincare regimens earlier than I would have expected.
Exactly. Acne is being seen at an earlier and earlier age. So when we start seeing those little clogged pores and things like that, that person is starting to develop the components that's going to lead to acne. And at that time, some of the retinoid ingredients, for example, adapalene, brand name Differin, is available over the counter. A small pea-sized amount every night is really great to decrease that comedonal acne and the clogged pores that you see in youth.
Okay, that's very important, I think, for all of us to know. Shifting a little bit, just to, in general, social media, TikTok in particular, has had this rise of dermatologist influencers and skincares everywhere on these platforms. Now, you're out there as a physician busting all sorts of myths and educating people online. Do you ever feel this pressure to kind of show up that you have to counter all this bad advice and you need to put out there the proper information?
Oh my gosh, yes. I think that is something that has really changed a lot in dermatology over the last several years. It's, in a lot of ways, so amazing to be part of a medical specialty that's constantly going viral, because we have this ability as physicians to perform mass education for people in the community that we've never had before. And our messages about skin cancer, about skin health, we have a platform that we can really broadcast those things to people, and people are interested, which is amazing. But then on the other side, along with this ability to provide mass education, comes an ability to provide mass misinformation for a lot of people who oftentimes are well-intentioned, oftentimes are not. Oftentimes they are their own kind of wellness people marketing their own products. So we all of a sudden have even more pressure to really step up and be part of that conversation. I know I've read that in terms of Gen Alpha, Gen Z, and millennials, the vast majority of these people really do look to online and social media for their health information. That is where they're going for health information. So we really have a duty in a lot of ways to be there on those platforms. And of course, learn how to appeal to people on those platforms, because the long format, explain everything and sit there is just not what's going to attract attention. So you have to learn to modify your messaging to fit that standard. And I think it's funny because as a derm, it's just, one thing I didn't realize going into dermatology was how interested people would generally be about dermatology. I mean, if I go to a party, it's like, as soon as I say I'm a dermatologist, everybody has questions. Everybody wants to show me a mole. I'm like, no.
I'd rather not see that mole.
But okay, I'll look at it, Marn.
I get a lot of eyeballs. Like, can you take a look at this?
And it's just really, people crave that knowledge. And I really appreciate being able to provide it, whether it's in TikTok or Instagram or whatever format we're using at the office to try to provide that information. But it does get frustrating sometimes dealing with the misinformation that's out there.
Well, I mean, there's so many controversial skincare trends, like the anti-sunscreen movement that we're seeing, where people are avoiding chemical sunscreens. I mean, you're not just a dermatologist, but you're a Mohs surgeon, which explain it for people so that they know what a Mohs surgeon is.
Absolutely. So Mohs surgery is my surgical specialty, where I basically focus on skin cancer removal using a microscope as a guide, and then repairing the patient after we've removed the tumor completely. So I deal with skin cancer all day, every day. And I can say 1 in 5 Americans will develop skin cancer in their lifetime. It's insanely common. And to your point, the anti-sunscreen movement is very vocal and very loud. Actually, last night, knowing I was coming in for this podcast, I just did a little perusal on TikTok just to find some of like the anti-sunscreen messaging.
Down the rabbit hole?
Oh my gosh. I almost brought in the names so I could blast them on the podcast, but I held myself back.
Okay, good.
But some of the messaging things like this would be, sun doesn't cause cancer, sunscreen does. And look at the incidence of skin cancer. It's been on the rise ever since we've been using sunscreen. Okay, so a lot of misinformation starts with this little grain of truth. And there is a little grain of truth in that, which is skin cancer is on the rise and has been on the rise since sunscreens become more readily available. But the reason for that is not the sunscreen, of course. As a physician, you're aware. It is the fact that we have more early detection. We're detecting more skin cancers. People have more outdoor activities than ever, et cetera. So while there's this kernel of truth that sunscreen's on the rise, the overall assessment of why is incorrect. But the problem is that particular statement and video had, I think, like 5 million views, million shares, thousands and thousands of comments. And these trends, these ideas are truly viral. There was one relevant to the eye, which I thought was really interesting. There were a lot of videos saying that if you wear eye protection like sunglasses, you'll get sunburned. And the kernel of truth they had in there, which I know it's like really hard reach here. The kernel of truth they had was they said because your eye produces melanin, and that is the sign to your body that you need to have more melanin and protect yourself from the sun. Okay, the eye does produce melanin, of course. That's what creates our eye colors.
Right.
But our skin is by and large the biggest producer of melanin, and that is what protects our skin for the sun. Our eye signaling something is not necessary for, the burning cascade to happen or not happen. And so some of these things are just super interesting, but they're being shared in a very viral way. And bottom line, I'd say we know that UV is a human carcinogen. We can study the process. We know exactly what happens biologically under the microscope when we get burned, the DNA breaks that happen that lead to cancer. We don't have evidence that sunscreen causes cancer. There's this huge debate about mineral versus chemical sunscreen. And as a dermatologist, oftentimes I recommend mineral sunscreen because, again, for teens and kids especially, it's much less likely to irritate the skin. Their skin is really sensitive. So mineral sunscreens, which are physical blockers, titanium dioxide or zinc oxide are the active ingredients. These basically coat the skin and reflect the sun rays. So the sun rays are not absorbed into the skin. Chemical sunscreens, on the other hand, which are any ingredients other than the two I mentioned, basically absorb the UV rays and then convert those to heat, which is dissipated out of the skin. So tends to be a little more potential for irritation with these because it's actually being absorbed more into the skin. So for kids, usually mineral sunscreens are best. For anybody with sensitive skin, mineral sunscreens are best. And then, of course, if you're like a little bit hippie-ish like I am, I have a holistic skincare line with Derm Actives. So I grew up in a very holistic household. My dad's a chiropractor and acupuncturist. I think if you have any concerns about, potentially toxic ingredients in skincare, then mineral sunscreens are your go-to. They're absolutely non-toxic. Chemical sunscreens, there is evidence that they can be absorbed into the bloodstream. That has never been shown to be clinically significant in the amount that people use sunscreens. So really think they're safe. Sunscreens go through FDA approval process, just like any over-the-counter medication does. So very, very rigorous approval process to approve new sunscreens. And I think people can really rest assured that they are safe.
And the other thing is Hawaii, I don't know if you know this, we have banned completely all chemical sunscreens because of the reefs.
Right.
Because it's causing coral reef bleaching and interfering with the marine life there. So you actually cannot buy a chemical sunscreen. I have to, if I want a specific chemical sunscreen for my face, I have to get it shipped to my parents in North Carolina, and then I have to hand carry it over.
That's so interesting, but I can understand, especially you have your beautiful, deeper skin tone. I'm so jelly.
Because sometimes now the mineral sunscreens come tinted, so I can use them and not look completely white.
The tinted helps, but they are sometimes not matching a person that's more deeply pigmented, not matching perfectly. So I can totally understand the desire for the chemical sunscreen. Actually, on the tinted sunscreen, I was thinking about this last night. I love this as a potential bridge between parents and these early preteens who want to have makeup and want to have skincare, because tinted sunscreens actually provide elevated sun protection compared to non-tinted. They protect against visible light, blue light, things that cause some damage over time and actually cause hyperpigmentation. So a nice way to kind of compromise with your child if you're not quite ready for them to use makeup and to get them to wear sunscreen could be to wear a tinted sunscreen.
And that's exactly what I've done with my daughter since she was little. And she calls it makeup sunscreen.
Yep.
And she now applies it with a beauty blender.
Yes.
Whereas I'm just like that with my fingers. But she's like delicately putting it on, part of her daytime routine.
They love the beauty blenders.
They love that
it's
beauty
makeup
blender.
now.
It's makeup, but it's good. And it's a physical one that we use for her. Because there now are some better options, but very occasionally I will get the chemical ones sent to my parents' house.
Yeah, I think I heard that teens are actually looking at the UV index. And if it's high, they're saying, okay, let's go out and tan. Because there's all of this messaging that tanning is okay, it's just you don't want to get burned, so you want to lay down that base tan, which is absolutely not true. We know tanning is the response to the skin in terms of when it's being damaged, it tans in response. And then a sunburn is actually more than just damage. Under the microscope, we can see that it's actually cell death. So it's truly an effect on the skin from UV light that results in actual damage, long-standing damage.
So we're kind of talking about this skin barrier. I know that's very hot right now on social media. I don't really know anything about it. Is it an actual thing? What do you really need to do for the skin barrier?
Absolutely. So the skin barrier is essentially the core function of our skin in a lot of ways. Our skin covers us and basically makes that definition point between what we consider our inside and what we consider the external environment. So the barrier function needs to keep hydration in, so keeping water in, keeping nutrients in, and keeping any of the elements out. When skin barrier is impaired, we can see problems with hydration. We can see overproduction of sebum, which can cause this like inflammatory acne. We can also just see irritation and inflammation. So a lot of preteens, teens, even adults, go through Sephora, get a million products and layer them on in a million different ways. Like, okay, I have to do this, and really can overdo it on their skin. Do-it-yourself stuff can be a huge overdue on your skin. And so when you strip the skin or create little micro tears in the skin, you can impair your skin's ability to be a successful barrier.
Oh, okay. And that was going to be my follow-up question about all these DIY skincare hacks
Yes.
that we see, like toothpaste on pimples and lemon juice masks. I've seen those.
Right. Yes.
Are they harmless or are they potentially damaging?
I think they're typically harmful. I mean, skincare products are tested. They run through a scrutiny of batany of tests to make sure they're safe for consumers and to make sure that they're not going to have bacteria growing, that they're not going to cause this adverse effect. Things like lemon juice mask can actually cause a chemical burn, and especially in conjunction with exposure to the sun can cause deep hyperpigmentation, which is really hard to get rid of. Things like toothpaste on zits. I think we all did that when we were kids. I'm like, it's so funny that they still do that.
I know, right?
Like we have better stuff than that now.
It's coming full circle. It's all coming
it's really full circle. It's like the jeans. Like your jeans, you just keep them in the closet long enough and they're going to become cool again
I
for
put them
sure.
at the top of my closet and then I just pull them down. Oh, wait, skinny jeans are back in.
I really like skinny jeans. I'm hoping they come back soon.
Me too.
That's my gene.
That is my gene too.
Oh, man. So, yeah, I think the problem is that basically they're trying all of these different things that they're kind of like mixing at home. There could be bacteria involved. There could be just a dangerous level of acidic content, for example, with the lemon juice. And all of those things are not going to contribute to their skin being healthier. Something like toothpaste on a zit. Toothpaste contains menthol and irritating ingredients. When teens have acne, one of the worst things that happens is they can develop post-inflammatory hyperpigmentation. So that's why we tell them, hey, don't pick at your zits. Don't touch them. Don't do this and that, because that can cause the hyperpigmentation to be more likely to occur. If you put toothpaste on a zit, you are essentially putting inflammatory ingredients on that zit, and you're going to be more likely to get hyperpigmentation from that acne. So no.
So possibly harmful. So that's good to know, because I think people think if they just make it in their home, oh,
Right.
it's not dangerous. It's all ingredients that are around. It's safe. I'm not throwing acid in there. Or whatever.
Versus if a teen does have acne,
Right.
I think there are many readily available things they could do to help themselves before ever even seeing a dermatologist. So benzoyl peroxide washes are very available. They're super cheap. That in and of itself can really help reduce the bacteria that cause acne on the skin. Salicylic acid washes, especially for body acne, I love those. And then the adapalene or Differin, like we mentioned, just a pea-sized at night, right before their moisturizer can really help. And then of course, just as we talked about, protecting that microbiome and that cell barrier function by using hydration moisturizer that's safe and gentle, but also just effective as a hydrator.
Okay, I love that. All right, so this is a good segue into a fun little game I want us to play. Smash or Pass.
Woohoo!
The Dermatologist edition.
Yes.
I want you to tell me smash or pass of all these skincare trends that I'm going to list out, and then tell me why, if you don't mind.
Great.
Okay, first one, slugging.
I'm gonna definitely smash that because my skincare line is waterless. It's actually something that is good for kind of perimenopause, menopause, older women, because hydration is such a problem for our skin.
Yes.
For teens, not a good skincare line for teens. So slugging, I'm gonna smash it for our age.
For us?
For teens, no.
Okay.
Because teens tend to have more sebum production, more oil in their skin. So slugging in general is basically where you have your thinner skincare ingredients and you add kind of a thicker, usually oil-based component on top to help protect that skin cell barrier and also just to drive in and lock in the hydration. I think it's great for people our age who maybe
Of a certain
we're
maturity.
having hormonal changes of our own. You're a little younger than me.
No, I think maybe.
I'm 45.
49.
No, I thought you were younger than me.
I just
Oh my
turned
God, you look
49.
great.
Thank you.
Go girl. So yeah, we're having our own hormone fluctuations while our kids are having their hormone fluctuations.
Yes.
Lovely timing. But for us, slugging is a yes. For teens, no.
Okay, sounds good. All right, skin cycling.
Okay, I'm gonna pass on that, but it's actually not bad. So it's funny because all these TikTok trends are really things dermatologists have used for like years, and then somebody coins it with a name, and then that becomes viral.
Okay, I don't actually even know what skin cycling
So
is.
skin cycling is this concept of you make, day 1 of the week I do this, day 2 I do this, day 3 for your skin. And it's maybe every third day or so you're throwing in that retinoid. You are basically spacing out the active ingredients over the course of days to reduce skin irritation.
Okay.
Now, if you're somebody that's sensitive to retinoids and you get really dry and flaky when you're using them, then yes, skin cycle it up.
Okay.
Skin cycle to your
Go,
heart's
go, go.
content. But I think, the reality is most of our studies about these ingredients are done based on consistent use for an extended period of time. With any skincare ingredient, you have to use it for like 2 months to actually see the effects. People are always like, I tried to use this for a week and nothing happened. It's like nothing is gonna happen for a few months at best. So something like retinoid, which is by far our biggest studied anti-aging, anti-skin cancer, best ingredient we have in skincare, has been studied for long-term use on a daily basis. So if you're only using it every 3 days, I do think you're getting benefits, but you may not be achieving that same level of benefits that we've seen in our data points.
Okay. Well, thank you for explaining that because I didn't know. And then that was retinol. We're going to the next one. What about retinol sandwiching?
Okay, so retinol sandwiching is another one that as derms we've essentially recommended all the time, but sadly I didn't come up with the term. Dang
You gotta market it.
I need to figure out something I tell people every day and make a name for it.
Make a like cute name for it. Yes. Okay. I'm good
If
with names.
anyone has any ideas, just write in.
Okay.
So retinol sandwiching is when you basically put a serum or some skincare product on your skin first, then you put your retinoid, and then you add a cream on it. So instead of putting that retinoid right onto your skin after cleansing, you're sandwiching it between 2 other products like a serum and a moisturizer. This is done to reduce irritation from retinoids. I am going to smash that because I have dry skin,
Yes,
and
me
so
too.
I'm somebody that has to be real careful with how I'm using the retinoids. I love the retinoid in my own skincare products because it's gentle but yet effective. It's hard for me to use all retinoids. Like the prescription one, I'm like, no, thank you. It's too much. So I think it's a good way for people to incorporate retinoids into their skin that might be sensitive. We don't truly know if that decreases the effectiveness of the retinoid, but we know that it still, does absorb into the skin and it is still effective in some way.
Okay. Ozempic face.
Well, I guess in a way I'm going to smash that because
all right.
I think, here's the thing. We're talking all about Ozempic face and I think it's overblown for sure. I mean, the GLP-1s have really changed a lot of things in healthcare and they've been such a sensation. Kind of scaring people about Ozempic face, I think is a little bit not the messaging I would give them. We know any weight loss is going to result in weight loss in your face. Your face is part of your body. I don't necessarily think Ozempic causes your face to just completely deflate or something. But I love that we're talking about it and we're talking about weight loss as a society because we as a society have a problem with obesity and overweight. And I think if there's a way for us to manage that, I think it's great. And we can deal in the dermatology office with whatever's happened with the face.
Whatever happens after the fact, yes, and keep your body healthy.
Yeah.
Okay, pore vacuum devices.
Okay, so these I'm gonna kind of pass. I'm gonna kind of sort of pass.
Okay.
They're fine, for occasional use. That's when these are suction devices that basically help clean out your pores. Most people really do not require that. I would typically use a chemical exfoliator to clean pores. So things like glycolic acid, mandelic acid is great and really gentle. These are for adults to use. These sorts of things will help naturally clear that pore without friction and rubbing and tugging on your face. So I think pretty much pass on that.
Okay. LED masks.
I like them. I think they're fun. I think they're we all look crazy when we wear them at home. I like to scare my husband with mine. But we know red light really does help with some anti-aging components of skin with collagen stimulation. Blue light is effective to help reduce inflammation and acne. So as part of an overall skincare routine, there's pretty much no downside. I'm going to smash that.
Okay, last one. 10-step routines.
Pass.
Okay.
I mean, as a mom of a 3 and a 7-year-old, there was zero chance that I can do that.
Yeah, right?
I mean, literally, I have to force myself and I brush your teeth, wash your face, put on a moisturizer.
Right.
That 1 minute.
Yes.
But even for people that maybe have the time to dedicate, mixing a million ingredients on your face twice a day is probably not going to help you and is more likely to cause inflammation.
This has been really, really helpful and such a great conversation to have, Kristina, about, we touched on, I think, so many different topics. If you could give just one piece of advice to parents who feel just really overwhelmed by all the products out there, what would you say?
Gosh, okay. Well, I'm notoriously long-winded, so maybe this would be a collection of advice. But I would say, use it as an opportunity to get to know your child. Get to know why they're interested in skincare. Is it because they have that peer pressure? They're seeing the filters online. They're trying to be somebody that maybe they're not, or really no one can be? Or is it they just really feel good when they do some self-care things? They enjoy talking about it with their friends. They get a little FOMO if they're not part of that conversation. And they want to do a few grown-up things and they want to try to be healthy. If we approach it that way, I think it can be a really great bonding experience for us with our kids and can really set them up for a lifetime of self-care and being healthy in many different ways.
I love that. Thank you so much for joining me today.
Thank
It's
you.
been an absolute pleasure.
Yeah, it's great to talk to you.
Thank you so much, Kristina. What a fun and educational conversation. I learned a lot to teach my own tween. You can find Kristina online at Dr. Kristina Collins. Thanks for joining me on In Focus. If you found today's episode helpful, I'd love for you to share it with a friend, leave a review, or hit that subscribe button so you never miss an episode. For more tips on eye health, parenting, and staying focused in a busy world, follow me on Instagram at Dr. Rupa Wong or head to drrupawong.com. Until next time, keep your vision clear, your priorities focused, and your family thriving.